adult mental health inpatient services. We've currently got 7 acute wards. This will soon be 8. 3 of those are based at Sherwood Oaks and 4 of those are at Highbury Hospital. The 8th will be at Sherwood Oaks. We also have a male psychiatric intensive care unit which is based at Highbury. We provide care to those aged between 18 and 65 with a range of mental health issues including depression, psychosis, mood disorders, personality disorders, and our service user group come from across Nottinghamshire and Bassett Law Services.
One of the challenges for our team, which is around the staff shortages, is the range of programmes that we put on and actually being able to have those staff released. So we're sat between that knowledge that our staff need to be developed and need to be invested in. It's how we recruit staff in, it's how we retain those staff. But the balance of that is making sure that our wards are safe and that those staff can be released. Having said that, our ward managers have been brilliant and have really invested in the different programmes and are releasing staff as much as they can.
We have constant challenges in terms of bed pressures, acuity, unfortunately violence and aggression towards some of our staff and peers, patient peers. So I think the bed pressures are one of the main things, and also we're always challenged in terms of recruitment and getting enough. So although we've done lots of good work, I think it's already been mentioned, recruitment is a big challenge for us.
I find that sometimes for my new role as a nursing associate, I've gone from a band 2 through to a band 3 and now a band 4. I think it can slightly be a challenge for the staff to recognise my change in role. So I've got to make sure that I really showcase what a nursing associate is and how we can then benefit the ward and the team.
I'm most proud of where my ward has come from. So in 2.5 years of me managing them, we've changed the culture on Redwood 1. It's gone from being quite an intimidating place that was known to be quite difficult for people to come and visit, to now it's much more open, it's friendly, the staff team all pulled together, and that's through a lot of hard work with the staff themselves.
I'm most proud of last year when I completed my competency for ECGs and bloods with the Trust's support and encouragement to complete the training.
I'm really proud that I can build a therapeutic rapport with patients and really just have that opportunity to get to know and bond with them.
Future plans for the service, continuing to look at new roles and how they can support the clinical teams. So we've got medication administration technicians joining us. We're recruiting more international nurses, hopefully. We've got some work planned at Highbury. Obviously Sherwood Oaks has recently opened. We're making some improvements to some of our wards.
So as the PQ here, we've also been contacted by the Royal College of Psychiatrists to go and actually do some workshops on the implementation of the least restrictive practices that we've started on the ward, and they've actually come and asked us to go and share that with other trusts.
I think this service is a credit to the Trust because it is, if you like, at the sharp end of admissions. They were often at high level of OPAL score, which is critical in terms of bed pressures and move on. All our patients are quite poorly when they come into hospital, so that's, I think, given the staffing, the pressures on beds, the recruitment, I'm really proud of how we continue to do a really good job for our patients, keeping the majority of them safe with some really good outcomes for most of the time, so I'm really proud of that.
We help a lot of people in crisis, and we give them some support that some of those people don't have out in the community.
I think despite all the challenges that we've talked about and all the things that are difficult, is that we still have really good patient feedback, and patients still get discharged and patients go home a lot happier most of the time than when they came in. And I think that's a real credit to the service,
definitely,
that we've done that through the pandemic with all the staffing shortages.